Now go on to our next speaker, Dr. Shruthi Nishanth, who is a cataract, pediatric, neuro-ophthalmic squint surgeon from Chennai MNI Hospital, and with a great future ahead. So on to you, Shruthi.
Yeah, thank you, ma'am, for this opportunity. So today I'm going to be talking about managing not the COVID pandemic, but the pandemic that followed that, and that's the myopia pandemic. So we know that when Corona came visiting us at 2019, it just bumped up our myopia scales, and the incidence of myopia just went skyrocketing. So a lot of studies have come in, but this was one of the earliest studies that came in, published in JAMA, where they said that especially in the younger age group, there was almost a 400% increase in 2020, while in the older age group, it was not as much. So definitely there is an impact. In fact, there is another study that spoke about how atropine, in spite of being on low dose atropine, the myopia progressed in the last 2 years because of the pandemic, which went to say that the environmental factors do play a big role. So before we go on to how to managing myopia, it is important to understand why and how myopia occurs. So myopia is a complex disorder which involves both genetics and environment. So genetics basically decides the age of onset, the rate of progression, and the final refractive error. And if there is one myopic parent, the odds ratio is 1.8, and if there are two, then it is 2.4. But what is more important is on the right side, which is the environment. We know all the factors that are there that play a big role in the progression of myopia. But to put it very simply, if genetics is the loaded gun, the environment is the trigger. So if there is an environmental factor, then myopia is the bullet that goes right through. So when it comes to the environmental factors, there are two important factors that are constantly spoken about. One is the sunlight outdoors exposure, and the second is the restriction of near work. When it comes to outdoors exposure, the light intensity matters. The higher the light intensity, more than 1000 lux, then the better the myopia control is. The light wavelength has also been studied to be of importance. That is, the red wavelength is the red color spectrum is found to be more harmful for myopia progression, and the violet end is found to be more protective. And of course, increased average viewing distance of objects is found to be a protective factor, and movement and sports. So this, what it does is it activates the spatiotemporal image response mechanism. So basically, more of the retina that is stimulated, the better is the myopia control. And of course, there's a small role played by the sustained pupillary constriction and the increased production of vitamin D. When it comes to near work, the things that we all know are the ambient light, the viewing distance, the blink rate, and the number of hours of continuous viewing. So in spite of all these factors, we cannot put it into three boxes. That is image quality, whereas a blurred image and a poor illuminated image can lead to myopia. A mechanical strain, where an increased accommodation and convergence can lead to myopia. And the third is acquired biochemistry, or so-called exposomes, which is spoken about now as the environment playing a role in myopia, which is nutrition, stress, sleep, and the other part of the environment. And put this together in a box with genetics, where they have a family history of myopia, and you have something that is called scleral remodeling, which is the basic pathophysiology of myopia that leads to the progression. So it's very important to note that studies have shown that it is a very retinal related issue, the myopia progression, and not a centrally mediated one. And it's more mediated by the rod mediated signaling more than the cones. And this is an important, an interesting factor, where you see that in monocular form deprivation chicks, they found there was an increase in the the mediators which promote collagenases at the end of the day 21. And you can see how the collagen has depleted in all these myopic chicks. So now that we understand why and how myopia works, how can we manage it in our clinic? So the first thing is to identify the patient. So we all know that myopes who are more than 0.5 diopters are definitely a part of the group. Lower than average hyperopes, the so-called at-risk pre-myopes, are the ones also to be included, and kids with parental myopia. So it's important to profile our patient with a good, questionnaire to know what they are going to, what kind of lifestyle they're leading. It's important to do a subjective, objective refraction, a cycloplegic refraction, a good axial length measurement, and a good BV evaluation. In the BV evaluation, it's important to do a cover test to rule out esophorias, because near esophoria is associated with high myopia, and a MEM retinoscopy, which is nothing but a dynamic retinoscopy, which measures the accommodative lag. So let's come to some holistic viewing of patients. So this was a 4-year-old kid, and on our questionnaire had parental myopia, was a bookworm with less outdoors. And on cycloplegic refraction, you can see that there's a very small plus, which is a pre-myope, and an axial length, which was normal for age. So this is a patient who would be called a pre-myope. In these children, we give them a lot of lifestyle advice, visual hygiene, vision therapy, and observe them 6 monthly. Now, this is another patient who's an 8-year-old, and you can see that there's no parental myopia for this child, and typical increased screen time with an outdoors of 1 hour a day. And a cycloplegia shows a minus 0.75 diopters and with axial length appropriately increased. So this patient would fall under the category of a new myope. And in this condition, we would just give them glasses for constant wear and lifestyle advice and observe them 6 monthly. Now, this child, third child, would be a 10-year-old child with no parental myopia. Again, demanding schoolwork, less access to outdoors. But this child has already been under my care for 6 months. And now, in the second visit after 6 months, shows a minus 1 diopter progression with a corresponding increase in the axial length. Now, this child was what we would call a progressive myope. And in this case, we start, we change glasses, but here we do some active interventions such as dilute atropine or DIMS lens. Of course, we have to give lifestyle advice with a slightly closer follow-up. So a little more about atropine would be covered by Dr. Ramprakash in the subsequent talk, but my protocols would be children more than 5 years with a documented cycloplegic myopic progression of minus 0.5 diopters, and that would make me start them on dilute atropine for 2 years. I tell them right away that it is a deal for 2 years. And if they don't progress beyond 0.75 diopters, then we continue them for 2 years, taper and stop it. And if they do progress, which means they're poor responders, then we either increase the dosage to twice a day or we consider DIMS lens. Now, these DIMS lenses are the newer lenses that are available. They're called defocus incorporated multiple segments from Hoya. Basically, they correct the hyperopic defocus seen in the myopic posterior pole, which is more oblong rather than spherical. So it consists of lenslets that are like plus 3.5 diopters add in the mid periphery, which creates a myopic defocus, thereby helping the focus be more perfect on the retina in the mid peripheral area. So finally, after all this we do, what do we exactly tell the parents? When it comes to online classes in the last pandemic, we have to talk about visual hygiene. So wearing glasses, bigger screens, bigger working distances, frequent blinking, sitting near a window, simple things like good natural lighting, enlarged font size, 20-20-20 rule, a good posture, and monitored outdoor breaks. So this is what we would recommend for online classes. When it comes to lifestyle changes, 2 hours of outdoor time every day, daily routines, a good physical activity, good sleep, diet, hydration, and of course, considering these kids have been in isolation, psychological health. So these are all important. So my final slide would be the keys to managing myopia is to acknowledge the fact that there is an amplified boom. Environmental factors do make a big impact. Understanding the retinal circuitry is key. Scleral remodeling is the primary pathogenesis. Customize the myopia control and consider dilute atropine and DIMS lens where required. Thank you. Thank you, madam, for this wonderful opportunity.
Oh, that was a wonderful talk. That was truly enlightening and reinstated a lot of